Hi, my name is Nikki McCarthy, and I'm here to talk about multiple disabilities. Multiple disabilities are defined as a student who has coexisting impairments. They have different disabilities. We have a combination which causes such severe educational needs that those needs cannot be accommodated in special education programs solely just on one of the impairments. We want to work to meet their needs of every disability they have. The term also, multiple disabilities, does not include deaf and blindness. That's completely separate. Some causes and characteristics of students with multiple disabilities. I have about 8 listed here, and there could be more, but things that can happen at the beginning are chromosomal anomalies, things that happen in prenatal and postnatal times when the mom is having the baby. Maybe there's genetics and hereditary involved. Infections could happen in the womb and outside the womb, or as the child is young. Some genetic disorders can be the reason for the disability. Traumatic brain injury also causes multiple disabilities, and poor development of the brain or spinal cord are another reason. Some general terms of multiple disabilities. Think about these questions. How many disabilities does the child have? Which disabilities are they? And how severe are the disabilities? There's so many different combinations of disabilities. It's important to know what disabilities that the child has, if they're mild, if they're moderate, if they're severe, and how does the combination of the disabilities affect the child and their learning. Some traits that are commonly shared with multiple disabilities are one is difficulty with generalizing their skill from one setting to the next. This could be a skill that they learn in your classroom. Maybe you're teaching them how to clean a table, how to set a table, how to eat with a fork or spoon, and then they go home or go to a restaurant and they're not able to take that skill and generalize it to those other areas. They get to that restaurant and they have forgotten how to use their spoon, or they go home and forget how to help mom wipe the table. Some communication or social engagement difficulties they might have. They might have some regression, difficulty in maintaining the skills that they've learned all school year. A lot of regression that I've seen through my years of teaching students with multiple disabilities is they've worked on a skill all school year. They've done a great job. Then summer hits. Maybe they did go to summer school, which is usually when it's down to 6 weeks now. It used to be 8 weeks. But then the rest of summer they have off, and then come back in the fall. Then you have to kind of start all over on those skills again because they may have regressed and they need to rework on those skills again. Some other areas would be mobility difficulty. Maybe they're hypertonic, hypotonic, have ataxia, or have trouble crossing midline. Speech production is another trait that's commonly shared. And some health conditions. So when I worked with students with severe disabilities, I had a few students that had many seizures. So you have to make sure that you are recording those, you know how long they lasted and what happened to the child while they were going on. If they have aspiration pneumonia, more than likely they're going to be home or in the hospital, but you also need to make sure that you know how to suction them out if they have extra fluids or they have a tracheal tube. And then another trait might be that we need to make sure that their medication is stable. Some students just take medication at home, but some have medication dosages throughout the school day, which is done by the nurse, but you also just make sure to keep everything documented. The early evaluation process. In this early evaluation process, it's common for a diagnosis to happen directly after birth or within a year or two of the child's life. Once the concern is identified, there will be formal assessments that are given by a team. So assessments that could happen in the hospital or in the first couple years of life are checking their reflexes, checking the child's vision and hearing, how their breathing is going, and how they're doing with fine motor and gross motor skills. And then some interventions for early years and preschool years. There's infant stimulation programs that can help with sensory, cognitive, and physical responses that will help the newborn babies. There's services and supports that are family-centered that will help those families. During the preschool years, you want to really make sure that you're getting that early intervention. And those programs go from birth to age 3. You want to get in there. Early intervention is key to working with their disabilities and trying to get them as high as you can and ready to move on to elementary school, kindergarten, elementary school. You want to work to maximize their fine and gross motor skills. You can do this at home and in the classroom. Self-care, teach them how to take care of themselves, whether it's brushing teeth, brushing hair, wiping their face, definitely washing their hands. Some play time is always great for our children that are young, learning how to play with other people, and social communication is also key. The evaluation process, as they get older, before supports can happen in the classroom, we need to make sure that parents have signed a form to give their consent for the evaluation. And also the evaluations, once you get into the public schools, is free of charge for the family. I know of some families in the past that have gone outside of the school and done their own testing and evaluations with other doctors and other places, and it costs them a lot of money. So make sure that the families know that this is free of charge once they get to school. The purpose of the evaluation is to make sure that we're gathering all the information we can about the child's disabilities and the educational and developmental needs resulting from those disabilities of the child. Once the evaluation is complete, the team meets. That also includes with parents to decide what services the child will receive given his or her individual needs. Supporting children with multiple disabilities. We want to make sure we're there to help them, to give parents tips, teachers tips, assistance, guidance, support, and advice. Most of our children with multiple disabilities will need some level of support throughout their lives. The level of support depends upon their disabilities. Children with mild multiple disabilities might just need occasional support, but children with multiple severe disabilities are going to need ongoing support the rest of their lives. Some support that we might give a child with major life activities would be working on speaking and communicating, teaching them how to care for themselves, performing manual tasks, working on hearing, seeing, sleeping, and eating. As they're younger, going into standing, walking, lifting, and bending. Or if they are needing physical therapy, there's other ways that we can work with exercises and working on lifting things and using standers for standing and then walkers for walking. Maybe we're working on their breathing, all the way up to reading and learning, working on concentrating, working on our thinking skills, and just working on work skills as they get older to get them ready to move on and be independent. Some tips for our educators would be to please make sure that you read about every part of that child's disability. You can do lots of research, but just find out everything you can about the disability. Know what their needs are. Work from their strengths. They have lots of them. So to find them, talk to the parents, and work from those strengths. Make sure you're making modifications and accommodations throughout the school day. We absolutely want to encourage independence as much as possible for each child with disabilities. Using assistive technology wherever needed. Some of my students have had iPads, other devices to help them communicate. It could also just be simple as a slant board while they're doing handwriting, a pencil gripper, just anything super easy that will help assist them wherever they need it. Work with your team, share your ideas. This doesn't mean just once a year at their IEP meetings. Talk to your team weekly, daily if you see them, but just come up with different ideas to help that student. Practice, reinforce, and consistency are key. We need to absolutely be as consistent as possible with these students. They thrive on it, and they do so well when we're consistent with everything that we're teaching them. If there's any behavior issues, make sure that you address those behavior issues. Make sure you have plans laid out. There's BIPs. You can work on some positive behavior supports. So you work on those behavior plans just to do the best you can and help that student. And make sure that you are training your paraeducators with correct procedures and what needs to be done for each child. And lastly, I'm leaving this slide up just to show some different resources for teachers and parents. There's a parent center, parents helping parents. There's facts about IDEA if they need to know that. The United States Department of Education, and then all of these, the next 4 websites I can click right to off of this PowerPoint, and then CAPS for Kids at the bottom. Now, that's just a few. There are so many resources out there, but we just need to make sure to get those in the hands of our parents and fellow teachers that need it. But overall, that is multiple disabilities in a nutshell. If you have any